Okay, this is going to be adrenal gland, sometimes also called the suprarenal gland, to the eye. Okay, so we are going to start off here in our kind of our abdominal cavity region. Our kidneys, along with our adrenal glands, are retroperitoneal, meaning that they are located behind the posterior layer of parietal peritoneum. And so what you can see is adrenal or suprarenal meaning that they sit atop the kidney or on top of the kidney. So you can see a left and a right adrenal gland here. And what we see is that you have asymmetrical drainage of the adrenal gland, just as you have asymmetrical drainage of your gonads. Okay, and it follows a very similar pattern in terms of left gonad, left suprarenal gland, right gonad, right suprarenal gland. So if we find the left one here, and we kind of dissect through some of these structures here to see this a little bit better, what we can see here is the adrenal gland, and we can see this vein right here. This is going to be our left suprarenal vein, or our left adrenal vein. Note that it goes directly into the left renal vein. Okay. If we come over and look at the other one, here's our right adrenal gland. Here is our right adrenal vein, or suprarenal vein. Note that it does not go into the renal vein, but it goes into the IVC, or the inferior vena cava. And so this pattern is the exact same as what you see with the gonads. The right gonad, just like the right adrenal gland, the right gonadal vein goes directly into the IVC. The left gonadal vein goes directly into the left renal vein, just like the left, just like our left adrenal vein, okay, or suprarenal vein. So, depending on if you're talking about left adrenal gland or right adrenal gland, you're going to start off different, but then ultimately you're going to end up at the same place. So, if we choose our left here, we're going to go from left adrenal vein to left renal vein to IVC, and we know from IVC we just follow it superiorly, so let's hide some of this here. We'll dissect through the heart a little bit, and so we end up in our right atrium. From our right atrium, we pass through our tricuspid valve into our right ventricle here, and then flow up and out of our pulmonary semilunar valve to our pulmonary trunk. Let's remove some of these structures here a little bit more. Up and through our pulmonary trunk to our pulmonary arteries. So there's a left and a right. To the lungs, we get blood exchange happen at the alveolar capillaries, and then we return via pulmonary veins, right? So here's a right pulmonary vein, and here are our left pulmonary veins. And from there, we end up back at our left atrium, so our oxygenated side of our heart. We then end up passing through our mitral valve, or our bicuspid valve, or our left atrioventricular valve into our left ventricle. And then when our ventricle contracts, we eject blood up and out through our aortic semilunar valve, and then we are now into our aorta. So we're in our ascending aorta, and from here, we're with this blood trace, we're going to go to the eye. And so we have to go from our ascending aorta to our aortic arch, and then we have a couple of options on where we're going to go. So if we know that we're going, if you know these branches, we have the brachiocephalic trunk, we have the left common carotid, and we have the left subclavian. We know that we have to be going up to the head, so we have to be using this either the brachiocephalic trunk or the left common carotid in order to get up to the head. The left subclavian branch is not going to do us any good. So if we go here with this view, we're going to start off by removing some of these venous structures here. And I'm going to remove the skeleton just so you can see this a little bit easier. So we're at our aortic arch, and we said we either have to go up our brachiocephalic trunk first or our left common carotid. I'm going to choose our left common carotid because if we choose the brachiocephalic trunk, we're also going to go to our common carotid just on the right side. So I'm going to start here on the left side. We're going to go left common carotid. And if we're going to our eye is a more internal structure. It's part of our nervous system. And we know that the common carotid has two branches. There's an internal carotid and an external carotid. The external takes you to the majority of the skull and more superficial structures. So this is what this branch is going to take you to. If you follow it out, it's going to get most of the external part of the skull. If we follow our internal up, this will transition and go up through the base of our skull and enter into our brain. So if I flip to this view here, we can see our same vessel here. This is going to be our internal branch of our carotid artery. Common carotid branches into our internal, and we see that there are different parts to the internal. There's a cervical part, a petrous portion, a cavernous part. These are just named according to the different locations that they exist as you arise in the brain. But what you get to ultimately is you get to this region right here where you have this branch, which is your ophthalmic artery. And so you may recognize this as being the circle of Willis, sometimes called the cerebral arterial circle. But this one branch here, our ophthalmic artery, is going to be the branch off of our internal carotid artery that goes out and supplies the eyes. And so if we add in eyes here, it may make it a little bit easier to recognize. We'll add in an eye as well as a left eye. And you can see how these vessels are going to be coming in and approaching our eyes as they get closer. So if we go back in here, we find our internal carotid here. We can go in, we can find that ophthalmic artery branch, and if we begin to zoom out, you can see how it's flowing and it's coming up towards our eyeball, which is right here. You can continue even further and you get branches that supply the retina. So these very, very small branches, if I zoom in here, this right here, this is called the central artery of the retina, and this is what supplies blood to the retina itself. Okay, so we started down at the adrenal glands, we worked our way up to the heart, we came up through our common carotid, our left common carotid, or you could go brachiocephalic trunk and right common carotid, to our internal carotid artery, up to where it joins the circle of Willis, and then we branch off of that and we become the ophthalmic artery, which we see right here, that supplies our eye with oxygenated arterial blood. So that is the walkthrough from the blood trace from the adrenal gland. Remember, the adrenal gland, it has asymmetric venous drainage, but this is our walkthrough from the adrenal gland.